without further ado, Dr. Guy.
All right, thank you. All right, we're actually almost done. This next section doesn't last quite as long. All right, so we just finished talking about love and belonging, which are the most important. And love and belonging are separate issues, by the way. There is love, which is the affection that we receive, and the belonging is when you view yourself, do you see yourself as a part of a bigger group? Family, a group, whatever, but do you see yourself as isolated and all alone, or are you a part? You know, when people go through a divorce, it's not just the affection that they are without, okay? It's the belonging factor, and that is a separate whammy. You used to be a mother, you used to be a wife, you used to be a husband, you know, you used to have a family, and you had a role in that family, and now that's over. That's an amputation. That's an amputation. Love and belonging are very huge. Okay? Now, purpose, the second biggest need, and I'm gonna go into detail as to why that is. There are two kinds of purpose. I call it purpose with a little p and purpose with a big P. Purpose with a little p is a reason to get out of bed. Okay? A reason to get out of bed. Your body wants to know, your brain wants to know that you are, okay? Yeah, right. Your brain wants to know that you're using your time and your abilities for a better future, either for yourself or your loved ones, okay? You need to have that. You need to have that. The average, when I was in medical school, now I haven't found a reference for this, but when I was in medical school back in the 90s at Michigan, one of our professors, I don't know if it was psychiatry or another field, but they taught us that the average man lived 15 months after retirement. 15 months. I thought that was kind of short, you know. So when my stepfather retired, I warned him. I specifically said, hey Dad, the average man lives 15 months after retirement. Do you have any plans? Because it didn't apply to women, only to men. You know, the idea was women don't just see their role as an occupation. They have a lot of things going on. And so they have their hand in multiple pots doing lots of things. And so there is no true retirement. But with men who identify with their job so much, when they stop working, they've got nothing. All right? And so they just sit around watching TV. And back at that time, the average man apparently lived 15 months. So I warned him, you better have something to do. He goes, oh, I got plenty to do. I'm like, what? I'll be cutting the grass, you know, getting caught up on my TV shows. Yeah, and he blew it off. 15 months later, he was dead. Okay? Exactly 15 months later. He died of cancer. 15 months later, exactly. Okay? So, I mean, that's an anecdotal story, but it does, I mean, it kind of go along. They weren't kidding, 15 months. Now, I don't know what it is today. That was a very long time ago. So I don't know if that has changed or not. Now, why is not having a place to go so important? You need to have a place to go, something to do that you believe is valuable, something that requires a little mental effort. Now, I mentioned this before in my last presentation about default mode network. Remember those three networks that we talked about? Default mode, central executive network, emotion network, and then the salience network, which decides which network to turn on. You can only use one network at a time. They do not run simultaneously at all. They do not run simultaneously, okay? So that's a big deal. Now, default mode network is what you run when default mode network is what you run when you don't have any goal-directed activity. None. No goal-directed activity. And so when you let your mind just wander, that's default mode network. And as I mentioned before, default mode network is self-referential. How am I doing? How does my house look compared to my neighbor's house? How does my weight compare to my neighbor's weight? How does my appearance compare? How do my achievements compare? You know, it's stuff like that. You start thinking about yourself, comparing yourself. You don't go anywhere. You dig up problems, but you don't solve anything. And that's what the default mode does. The central node for the central executive network is the posterior cingulate cortex. And the more it runs, the more depressed you become. And that's what we talked about last time. The more you operate the default mode, the less you operate the central executive, and your central executive starts to atrophy. People with no depression and happy moods have high synaptic density in the central executive network because they're using it. People with low synaptic density are depressed. The lower the synaptic density in your central executive, the more depressed you are. The higher the synaptic density here, the more depressed you are. So default mode is bad for you. If you don't have any goal-directed activity and you find yourself constantly not having anything specifically to do, then you just keep running default mode, digging up dirt, and falling into a more depressed state. And what happens in negative emotion? Your body falls apart. Okay, it causes all those inflammatory things going on in your blood, and you age at an accelerating rate. And some of those accelerating processes do increase your risk of cancer, okay, and other diseases. Okay, so default mode is bad. That's why you need to have that. Now, when you are young and you are just out of work, sitting at home all day, that you're running default mode. All right, you're running default mode. That's why it's depressing. Some of my patients, they come in and all they want is, especially at Easter sales, they come in and they just, I want to be on disability. I had a patient who won't acknowledge that he has a psychiatric condition. Why are you here? I want to get on disability. Why are you here? I want to get on disability. And I'm sitting there, so I'm trying to go through and figure out, okay, I see that you do have some problems here. You got, sounds like, from what I'm thinking, you got a little bit of schizophrenia going on here. It's mild, but I'm picking that up. But he will not acknowledge that. He won't take any medicine. He's there to get disability, okay? Some people really think that that will solve their problems. Getting that check is going to solve their problems and make them happy, because then they can do what they really enjoy, staying at home and watching TV. Not good for you, period. I try to stress that over and over again. It sounds nice, but let me tell you, sitting around watching TV is only fun if you're cheating. Okay, if you're supposed to be doing something else, then it's fun. Okay, if you're supposed to be doing something else and you watch TV, then you can enjoy yourself. But if that's all you have, it's like, oh my gosh, this is so boring. And then you realize how horrible the writing is, and it's like, oh, it's not even fun, man. No, it's gotta be an escape. Then it's enjoyable. But if that's all you have, it's not fun at all. Okay, and so you're getting depressed because your life is going nowhere, and your brain can't handle that. Your brain can't handle having nothing to do. Your life is burning away, your time is burning away, and you've got nothing to show for it. Your brain is not happy with that. You might be happy with it, but your brain isn't, and that's why your depression's not going anywhere. All right? So, purpose. Your brain needs to know that you are using your time and talents to improve your future or the future of your loved ones. Okay? Very important. Turn off that default mode. Now, purpose with the big P, that has to do with the sense of divine mission. Why are you here? Now, this is not very huge in many young people. It really starts to kick in with each passing decade. So once you pass 30 and then you get to 40, 50, 60, with each decade, this tends to be felt on a higher level. Okay? Why are you here? Life is very painful. There's a lot of loss. There's a lot of pain. There's an unfortunate amount of shame that goes with everyday living. And most people would say, this isn't what I signed up for. It's a lot more difficult than I thought it would be. A lot of hiccups that I didn't think I'd have to deal with. And here they are, dropped in my lap. So what's the point? If I have to go through all this pain and loss, then why? What is the point of all this? Because if it's to have fun, it's not working. Okay? So the brain asks, where am I going? What am I doing? What is the meaning of life? Why do I exist? And this is called an existential crisis. And you see it in older populations where they're asking the question, what's going on here? Now, people without a sense of purpose, without a sense of divine mission, have a very high incidence of suicide. We've known that for years and years and years and years. Countries that are predominantly atheist have the highest suicide rates of all other countries. Individuals who identify as atheists have always had the highest suicide rates of all groups. Okay? The brain needs to know that there is a point. It can't handle that life just exists and then you die. I mean, for crying out loud, once you past 25, it's look what you have to look forward to, Just all the things that you achieve, now they're just going to go gradually. You have to slow down and it's like, really? Yahoo, sign me up for that, okay? If you're very extrinsic, that can be challenging, it can be scary. If your values are completely extrinsic and you're into beauty and talent and ability, well, guess what? You're watching your own demise. Once you reach your peak, it's downhill from there the whole way. And that's why having those intrinsic values having an intrinsic purpose is so important. You know, is there something on the inside that is actually growing, that is maturing? Are you getting better? Do you feel that you are achieving the purpose that God put you on earth to achieve? Are you improving in your relationship with God? Or do you have so much guilt and shame that you've abandoned all hope? Okay, those are really important questions when it comes to fulfillment. All right, now, the objective is not happiness. And that's something I have to get straight with people. I am not here. Our mental health does not exist to make you happy. If you make happy your objective, that's a bad thing. That's not, happiness should not be your objective. Definition of happy: feeling or showing pleasure. Melissa came in looking happy and excited. Fortunate and convenient, getting your way. He had the happy knack of making people like him, getting things the way you want. So getting control and feeling pleasure. Yeah, you make that your target and you're in for some difficulty. Yeah, you end up a drug addict if you make that your target, okay? Feeling happy is not going to make you happy, all right? Aim at fulfillment, and happiness is thrown in as a freebie. But you have to aim at fulfillment, which means getting enough of those needs. Fulfilled means to develop one's full potential, to be satisfied because of fully developing one's ability or character. All right? Getting enough of what you need to be satisfied. All right? That's what fulfillment is about. Enough love and belonging, enough purpose, enough respect and self-respect, enough freedom from excessive manipulation, enough positive emotion, including joy, contentment, gratitude, awe, and excitement. All right? If you have enough of those things, then happiness kind of floats along. And that fulfillment protects us from the extremes of mental illness, from anxiety, depression, and so forth. Because one thing I ask, when I go through this list with patients, I explain briefly what they all mean, and then I ask the question, can you think of any holes right now in your life? And only 1 out of 20 will say no. 19 out of 20, without hesitation, will point to the holes. They know where the holes are. Once you explain that to them, they immediately know where the holes are. Now that 1 in 20, it's usually because of something that's been done to them. Okay? Like the people that come in and they just found out that their spouse has been cheating on them. Or they've just lost a kid. Okay? Something along those lines. In which case, that's an adjustment issue and that doesn't count. But when it comes to people with long-standing major depressive disorder, generalized anxiety, and so forth, they will tell you where the holes are pretty quickly. And then I say, okay, talk to your therapist about that. Okay, because the goal of good therapy is to help you identify where the holes are and what you can do to fill them in. That's what a good therapist will do for you. All right? And I also warn them, don't fall into the rent-a-friend relationship, okay? Now, one of the things in therapy, we meet people who we try to help. We try to go through a workbook and teach them these skills, and they never do the homework. And it's easy to get burned out with those people, you know, and say, you know what, you're not going to do it anyway, so why bother? So I'm just going to sit here and say, how was your day? What happened last week? How did you feel about that? Okay? That's rent-a-friend, where you're just there to be supportive. All right? They're not really getting much out of it, and if they have significant anxiety disorders, they're going to keep having that anxiety disorder because their brains have not been fixed. They're still interpreting reality the same exact way. You know, physical therapy is painful, but it works. When you go through physical therapy, if you don't do it, you could literally lose function of a limb. Okay, and it hurts to do it, but guess what? It works. But you have to push yourself. Same thing with psychotherapy. In order for them to change, they need to do the work. They need to do the work. Okay? So a lot of this is on them. They need to do it. They shouldn't just settle for rent-a-friend. But what happens if they fail to do the homework, then that's what they're settling for. And I try to stress to them, you know, look, do the exercises. When you leave the therapist's office and they give you exercises, do them. That's the only way you're going to get better. You need to do this stuff. You need to be an active participant in your therapy. Okay? Once you fill these holes in, you'll find yourself moving to a better place. But it's very important that you do that. Okay? Let's see here. All right. Any questions on that? Now, of these last 5, positive emotion, I do want to say, I mentioned that positive emotion undoes much of the negative biochemical pathology of negative emotion. And for example, if you measure interleukin-6 level is a really nasty stress hormone. And when you're upset, it skyrockets, and that's what can contribute to diabetes and cancer and atherosclerosis and cerebrovascular disease and Alzheimer's and all that stuff, okay? So interleukin-6 isn't your friend. When it goes up, your body's in the process of decaying. Now, all these positive emotions have the ability to reduce interleukin-6 levels, okay? Now, one of them is more potent than all the rest. Okay, we've actually, I may have said this in another talk already, but it's really, I found it very impressive because I couldn't guess it. Okay, joy, contentment, gratitude, awe, and excitement. Do you know which one is the most potent at reducing negative emotion?
Gratitude.
Awe. It's awe. It's awe, yeah. Awe, whenever you go. Yeah.
What about shock?
Yeah, well, that's part of it, yeah. Yeah, awe, yeah.
Where does grief fit in there?
Grief is...
As an emotion, because it's a part of our human reaction to death or loss.
Yeah.
And so I have a difficult time categorizing it under negative emotion.
It's still a negative emotion. Grief is still, it's a negative emotion in terms of, if you look at blood chemistry, it doesn't care why you're grieving. All the negative emotion cares about is that you are. And so it does. The temporary depression, the experience with grief is still depression. So yeah, grief is a form of depression. It's not maladaptive in the sense that it's not pathologic. It's normal, but in terms of its effect on blood chemistry, it's the same as any other depression. Now the thing is with normal grief is that for one thing, when you first have a traumatic injury, both psychological and physical, you don't experience the full force right away. If anybody who's been in a severe injury, you know that it's not painful for the first 15 minutes. Okay, I remember one time I kind of got caught on fire, and it was really painful. But initially it wasn't. Like after the fire was over and I saw my skin hanging off my body, I'm thinking, this doesn't even hurt. Look at that. I look like a monster, but I'm fine. That must be really cool. Then I realized, no, it's probably going to hurt later. Okay. And sure enough, 15 minutes later, it's like, okay, get me to the hospital like now. All right. Yeah. It's like, that's how it works. Same thing if you lose a limb. If you're out and you fall and break a leg, it doesn't hurt that bad at first. Your endorphin levels are so high, you don't really feel it. It's like you're given a few minutes to get help, and then the pain kicks in. Okay? Same thing with emotional loss. When somebody close to you dies, at first you might cry and wail, but it doesn't, the full force of it, oh no. You start feeling it when the holidays roll around, when the anniversaries roll around, when circumstances that you used to do together, when those pop up. Now it starts to unfold, and now the grief starts hitting you. Now normal grief, it lasts for a certain amount of time and you get over it, you recover. When people don't recover, then that's when it becomes pathologic, because now you're regurgitating this negative emotion over and over and over again. And some people use that grief as an excuse to shirk responsibility and to behave badly. Right now, I had a guy earlier this week whose grandmother was murdered like 10 years ago. And he's blaming his antisocial behaviors on the loss of his nana. Okay, and I'm going, dude, no, probably wouldn't help because he's very antisocial and he doesn't really, I don't know why he keeps coming, because I don't think I'm doing anything for him, because he doesn't listen. He doesn't listen to anything I say, okay? And he does these terrible, terrible antisocial behaviors, but he justifies them because God killed his nana 10 years ago. All right. Now that is, if it's true, it's a pathologic. In his particular case, I think he's just using it to justify criminal behavior. Okay. But there are people that will literally regurgitate a loss like that over and over again. I had a patient many years ago. One of my first patients. I treated him for very severe depression with psychotic features. And one day he brought his father in, and then I understood why my patient was so sick. His father, their mother had an affair and left when the patient and his brother were like 5 and 7. And she left the family, abandoned the kids, and went off and had an affair. So dad got the 2 boys. Well, he talked about what a slut their mother was every single day for the rest of their lives. Both boys ended up with serious mental illness. In my office, the woman had been dead for like 10 years, and he's still going on and how horrible the mother was. And I'm like, dude, let it go, man. I mean, seriously. It's been like almost 50 years. I mean, you're still going on about this, regurgitating it in your mind over and over again. That's why you look so old, man, because you're just poisoning yourself with this negative emotion. All right? If you don't let go of that stuff, yeah, it poisons you. It affects your health. And if you keep doing it, you can look at the effect it had on the children. I mean, you stressed your kids out with this nonsense. Okay? I don't care what somebody does to you. If you don't get over it, it has a very toxic effect on yourself and those around you. Yeah.
I have a lot of patients who try to get over it themselves, without a community, and find a lot of avoidance mechanisms.
Yes.
And so that's not helpful.
No, it's not. No. If they try to use avoidance mechanisms and they don't reach out and that is unhealthy. And I think it's important that we communicate. Look. Medicine and therapy are not going to help you if you don't try to fill in this hole. You've got a love and belonging hole in your life. It is necessary, and the reason I'm doing this presentation is I'd like you to stress to people, look, we're very limited in what we can do for you if you're going to isolate, if you're not going to take chances, if you're not going to listen, because we talked about that psychoeducation stuff, and some of you people need to learn how to be a friend, because you do not have the skills for relationships, period. You're too selfish, okay? You've got to make eye contact, okay? You can't just jump to conclusions and accuse people of stuff. These are things that, I wouldn't say this to them, but these are things you should have learned at 8, but since you don't, let's do that, okay? But, that would kind of be condescending, I think, but, but the thing is that, there are some skills that in order to be a friend, you have to learn. And they, previously they were kind of common sense. They're not common sense anymore. They are not. They are not. We have a population that is emotionally, they have a very low emotional IQ. And in order for them to pursue and have good relationships, they have to learn to be a friend, what it takes. There are character traits that are necessary. It's not hard, it's not impossible, but they need to understand. And the problem with cluster B traits is that if you tell people that they're not in a good place, that they need to change, you risk exciting that sense of shame, which leads to anger and projection and denial and rationalization. And so that's the thin line we gotta walk. We wanna make sure we don't hurt their ego too much, but we need to be able to stress to them, look, there are skills you have to have, okay? You can have relationships, but there are things you need to change in order to keep relationships, okay? So very important. Yeah?
Yeah, just that in light of that, again, I'm back to grief and loss.
Yeah.
I invite my patients to embrace it and let's take a look at it. It's almost
Yeah.
like a root canal. You got to get to the pain.
Yeah.
And then we can work at healing that pain.
That is so important for all. You're absolutely right. Let's take a look at this. Look at the detail. What actually are you experiencing? Because the more you leave it nebulous, the more you just ruminate on poor me because I'm not. We got to think, why do you feel this? Because it's not for the person. They're gone. They're already off to their next existence. But for us, when we lose people, it's like an amputation. They were part of our world, and now our world is forever changed. Okay, and now what does the new world look like? And that's where that's what we have to deal with. And so what are you grieving exactly? And let's explore that. And then what can we do? Because you lose one thing, but we can move on. But in order to move on, if we continue to ruminate on our grief, the likelihood of finding good relationships, if we're going to be stuck in that, is going to be much less, and we end up freezing ourselves in a bad state. So, yeah.
Well, I like to prepare the patient too that there will be moments in your life where that grief will be triggered and will take you right back to
Yep.
the moment.
Yep.
So that when it happens, a lot of times people will say, well, I'm not grieving right then because now I'm feeling what I did 5 years ago. I thought I was over it.
Yeah, that's a good example. Yeah, you're warning them because those triggers are coming. Yeah, you don't get all your grief out at once. No, it's those.
Well,
it's
and
exactly
that
those things.
Was a part of you, and so you're
Yeah.
not going to totally be distant from that. There'll be a part of you.
Yeah. Very true. Yeah.
I have a question.
Yeah.
How is someone's schema or belief system influenced by experiencing positive emotion? So some clients say, I don't experience this positive emotion, even when I'm doing things that are supposed to evoke positive emotion,
Mm-hmm.
I'm not getting the same or the expected.
Well, this is something that I'd say within the last 5 years, I'm seeing more young people coming in with this anhedonia, and it's becoming more common. It's quite frustrating, in a lot of ways, because, doing externals doesn't necessarily produce positive emotion, okay? So, it has to do, a lot of times in these individuals, if you take a look at that list of 5, a lot of times positive emotion is happening if the first 4 are satisfied. And individuals with chronic anhedonia, that's often not the case. Take a look at their love relationships. What you will often find is that they're extremely superficial, very extrinsic, and you really don't have that. They're not involved in giving true affection, and they're not receiving it. And there's the problem. In most of these cases, it's because of lack of purpose and poor interpersonal love relationships. Okay, very rarely will you not see. If those first 2 are met, I've never seen a case of chronic anhedonia where the first 2 are actually met. All right, yeah.
What are some of a lot of my clients come back from seeing you and you talk to them about inflammation of the brain.
Yeah.
And you give them over-the-counter things to help with that. What are some of those things that help reduce the inflammation?
Well, that's a long talk, but I'll go through some of them. Okay. Well, boy, where to start? Okay, we'll start with turmeric curcumin. Okay, turmeric curcumin is a spice. It's related to ginger, and it's very high in antioxidants and anti-inflammatory agents. When it comes to as a supplement, the health benefits are higher than almost any spice. I say almost because there are others with very high potency as well, but we know that in countries where they consume lots of turmeric, they have much lower incidence of cancer as well. Okay, cancer starts with oxidation and inflammation, and turmeric is a very good general anti-inflammatory and antioxidant. There are actually clinical studies showing that turmeric actually does have antidepressant effects. Now, depression and inflammation are very much related to each other. The higher your inflammation, the worse your depression. Okay, now what is the mechanism? We don't know the full mechanism. However, one mechanism is that depression blocks motivation. Okay? Now what is motivation? If you were to take a look at the brain, what you'll see that motivation works because the ventromedial prefrontal cortex communicates with the reward center, all right, the nucleus accumbens. So what happens is that, let's say you're thinking, this weekend I am going to go to the cider mill, for example. And you're thinking to yourself, should I do that? Well, what happens is when you have the thought is that your motivation center takes a look at your reward center and asks the question, was that fun the last time we did that? And the reward center says, yeah, here, let me give you an example. And it gives you 5% of the pleasure that you had last year when you ate those donuts, okay? And so, oh, you know what? That's kind of cool. You know what? That feels kind of nice. I'm gonna do that. And so you get off the couch and you call somebody and say, hey, let's go do that this weekend. All right. So what happens is that the ventromedial prefrontal cortex communicates with the dorsal striatum, which activates your muscles to get up and make a phone call. All right. And that's how motivation works. Your motivation center talks to your pleasure center, and then that works on your activity center. Okay, that's motivation. Now, the higher your inflammation, which again, when inflammation goes up, the principal marker is interleukin 6. All right, when interleukin 6 levels go up, it turns off motivation. We can actually measure that. When you take animals and you inject them with interleukin 6, and then you do functional neuroimaging, you can see that motivation center turns off. When you are inflamed, you are not motivated to do anything. Why? Because your body is saying, you're sick! What are you doing? Eating donuts, okay? You're not supposed to be going anywhere. Stay home and heal. Don't have fun. You shouldn't be having fun. You should be healing. Okay? And so interleukin 6 turns off motivation. Now, depression causes inflammation. And you're not even sick. And so depression turns off motivation. Inflammation turns off motivation. And so this lack of motivation, this anhedonia, then is perceived as more depression. So inflammation causes depression, and depression causes inflammation. You end up with a positive feedback loop. All right? And so when you take anti-inflammatory agents like turmeric curcumin, or another one, N-acetylcysteine. Okay, N-acetylcysteine crosses the blood-brain barrier, is turned into glutathione, and that acts as an antioxidant and anti-inflammatory agent for the brain. It's very powerful. Now we know that people with very severe stress disorders, when you're talking eating disorders, okay, cutting, they have really, their emotional state is so severe that they tend to have high inflammation. And you can measure that using high sensitivity CRP. HSCRP, high sensitivity C-reactive protein, is a way to measure inflammation by proxy, okay? And so what you find is elevated inflammation in people with that kind of stress when you can actually use N-acetylcysteine to actually improve their mood. But it takes months before you see the effects, like 4 months. And what is it doing? It's just lowering inflammation, and it helps reduce their anxiety and activity because of the reduced brain inflammation. So not all anti-inflammatory agents soak the brain. Turmeric and N-acetylcysteine are my 2 favorite agents for reducing that. Okay, so now the dose is pretty hefty though. I mean, for turmeric curcumin, you want to take like 2,000 milligrams a day. And I always say, make sure if you're buying turmeric over the counter, make sure that it says with bioperine, because bioperine is the active ingredient in pepper. It allows the turmeric to actually cross the blood-brain barrier, or to be absorbed into your bloodstream. Without bioperine, turmeric just sits in your gut and goes right through. Okay, you need some black pepper in order for it to be absorbed. So if they buy turmeric, I tell them make sure that it says with bioperine, or you're wasting your money. Now the dose of N-acetylcysteine, it can be pretty high. I mean, we're talking like 2,400 milligrams a day. So they're usually 600 milligram capsules. So about 4 capsules a day, and you don't see any change for about 4 months. So that's why, I usually use, those are special circumstances where I'll whip that out. There is some evidence also that in young people it helps with cannabis use disorder. Okay, and acetylcysteine can. All right. So for older people, the evidence isn't as strong though. Right. Now, there are other things. Now, food-wise, there are a number of things that have anti-inflammatory properties with psychiatric consequences. Blueberries, as we talked about last time, are high in polyphenols and anthocyanins, okay? And one of the things that blueberries does is that it raises brain-derived neurotrophic factor, all right? Now, I mentioned before that low density in the central executive network is associated with depression. Increasing BDNF helps to undo that effect. And blueberries can actually have that effect. There is a stronger berry that's 3 times as powerful as blueberry called the chokeberry. Chokeberries are actually more potent. 1 ounce of chokeberry is equivalent to 3 ounces of blueberries. Okay? Very, very high in anthocyanins and polyphenols. All right? Cloves are the high of all substances known to man. Cloves have the highest amount of polyphenols of anything. Okay? I mean, for every 100 grams of cloves, you get 15 grams of polyphenols. Whereas chokeberries, it's more like 4 or 5 grams per 100. But, I mean, that's a lot. So, when you're talking about polyphenols, you have multiple benefits. You have anti-cancer, antidepressant, anti-anxiety, anti-inflammatory bowel, anti-autoimmune disorder, anti-heart attack, anti-stroke. I mean, it's amazing. It's like, if you look up polyphenols from vegetables and fruits, it becomes evident that these foods are like medicine for us. All right, they really have a medicine-like effect, and that's why this topic is so, it doesn't end, because there's so much here. I mean, one thing leads to another. I mean, this is a topic that I could really start talking and not end because there's so much stuff, because one thing leads to another. One of the problems that we have, in addition to cultural changes, is the dietary changes, and that's kind of another program, but one of the things that we see very commonly today are food allergies. All right, now food allergies, back in the 60s and before, you didn't see food allergies, okay? Now why not? Why are food allergies? What happened? Did people suddenly have a genetic change and food allergies became a thing? No. What happened was a dietary change. Is that people started asking their kids, honey, what would you like for dinner? And the kids would say, McDonald's, Burger King, Pizza Hut, okay? And this is very common. And so what got voted off the island was vegetables, all right? Vegetables got voted off the island. And so the problem is that many of those colored vegetables are rich in polyphenols, okay? They all are. They're rich in polyphenols, anthocyanins, and vitamin A, natural vitamin A, okay? Now, what does natural vitamin A do for you? One vitamin A molecule is 2 retinoic acids. Retinoic acid stimulates your bowel epithelium to thicken. And so if you look at your duodenum, you should have if magnified, your duodenal cell wall should be this thick. A nice thick duodenal cell wall prevents molecules from going from your food into your bloodstream. You don't want whole proteins. When you drink milk, your blood should not see any casein. Casein is the principal protein in milk. Casein should be broken down in your gut, and the individual amino acids cross the epithelium and get into your bloodstream. Your blood should not see casein. When you eat an egg, your blood should not see the egg protein. It should not see that. When you should not see whey, you should not see egg, you should not see albumin from that. When you eat bread, you're not supposed to see gluten in your bloodstream. Gluten should be broken down and only the amino acids. And so if you have a nice thick bowel, then that's what's going to happen. But if you don't have enough retin A in your diet, then your bowel is thin. And what we're seeing is whole molecules are getting into these children's bloodstreams, causing an allergic response. All right? And so one of the things that I do recommend when you see a bunch of food allergies like that is like, look, you need to start eating more colored vegetables. And sometimes there are certain other amino acids that I'll also recommend to stimulate that. But yeah, it's called leaky gut syndrome. And I'm a firm believer in leaky gut syndrome. Some doctors say, well, I don't believe that. And I go, well, you need to look at the research now, okay, because it's a lot stronger now. The case I think has been made for that. All right. So the thing is that if you have a lot of food allergies, your inflammation is going to be high. Inflammation is going to affect your mood. And so you see how this stuff does affect us. It does affect people's brains. All right, inflammation affects brains. Diet is a big, big thing. Those polyphenols and those things, they are medicine for your body. They are medicine. This is a big topic here. Your cholesterol. You have multiple fats in your blood. You have your cholesterol, you've got LDL, you got HDL, okay? LDL cholesterol can be oxidized or reduced, all right? In the oxidized state, it's bad. If you don't have enough anti-inflammatory agents in your diet, then your blood is walking around very oxidized. That is pro-inflammatory. And as your blood is circulating, it is accelerating your own death. It is accelerating the aging process. Okay? Basically, one of the reasons that your organs and skin get old over time is because of progressive oxidation. All right? Now, our ancestors aged a little bit more slowly because they ate lots of colored vegetables. Their diets were full of berries and colored vegetables. And those polyphenols protected them. It basically reduced the LDL cholesterol. And so what happens is their blood vessels did not clot off so rapidly. But today, because of our dietary changes, people are living shorter lives. They are experiencing diseases of old age much sooner. And very much of this is related to diet. Okay? This talk just goes on and on. But
Thanks, those are some good ones.
Yeah. So it gives you some idea. Yeah.
I have a question,
Yeah.
going back to love and belonging.
Sure.
So if you're sitting with someone that has lost their monogamous partner.
Yeah.
How do we provide maybe some biological hope? Because, if we're monogamous, if we're destined to pair with this one person, how do we help them?
Well, the thing is that fortunately, we're not vultures, and it's not, or prairie voles, okay? So it's not, the biological imperative isn't as strong, and so obviously people die, and so because of the long lifespan of humans, it's important that that's the case. That's kind of why people can have affairs and stuff like that, because the imperative isn't so strong that if you lose a partner, you don't have the ability to find out. If you have a short lifespan, that's it. That one goes, you're toast for the rest of your life. You can't, no hope for you. Too bad, because you're one Glenn, so you're doomed to stay in the den all by yourself. With our long lifespans, I think that's one of the reasons why we have that play in there, and so you can do that. What I do recommend, though, is I strongly recommend divorce recovery groups, because when you're going through that, it's extremely painful. The friends that you used to have that knew you as a couple, very often you don't go to those guys, they feel awkward around you, and so it's really lonely when you're in that situation. So I highly recommend divorce recovery classes. You need to recover from this, and this is, and you need a setting where you have people you can identify with so that you don't feel so bloody alone. Okay, it's really important. Yeah?
Are there any groups in the area that you'd recommend?
It changes, and so if there is a lot of times a lot of the churches will have divorce recovery groups and stuff like that, and so I would kind of have to Google that for the area. I know some of the churches over in the other part, but in this area, they do have them. I think I'm sure you're probably aware of some of them here. What's that? Yeah, Woodside. Yeah, yes, Woodside has it. Yeah, in this area. Yeah, Kensington. Yeah, a lot of the big churches will have those, and they're always got people. They don't run out. Yeah.
Just speaking about, I can't remember all the specifics, but about how, it's when you're sick or your body's inflamed or whatever, because you're sick or not feeling well or injured. And really a good antidote to that, as much as you can, it sounds like, is to do something fulfilling or fun or increase those positive emotions by connecting socially. Isn't it kind of yucky? It's really unfortunate that there's that stigma of chronic illness and you shouldn't be having fun. You're sick, you're unwell, you need to stay home. Why do you deserve to have fun if you're not well? I don't know. I guess I don't really have a question, just a comment on that seems. It's unfortunate that there's not more public knowledge that that's completely opposite of what you would need. So
let me see if I understand what you're saying here, that when you've undergone a significant loss, societal expectations that you should stay unactive and unengaged to show how sad you are.
Mm-hmm. Or chronic illness or chronic pain, anything like that.
Or if you have a chronic illness or in chronic pain. I think that it's very important to alter public perception about that, because if you take a look at the science, what we know now is the very opposite of that. You should be as active as you can. You should be exercising, you should be getting out there. That is the healthiest approach. Mm-hmm. Wallowing in your pain is the opposite. It just continues the issue.
Right. Or insurance companies who may say, you're able to do that, so you should be able to do that.
Oh, it's a
right.
whole other matter.
It's really unfortunate because science is showing otherwise.
I know, yeah.
This may be a bit too broad or vague, complex for the time we have. Can you think of any other cultural factors, Western culture, American culture, that are contributing against this love and belonging, this love and purpose?
Well, oh boy, there's so much. Child-rearing practices have, basically, we have settled, our culture, without any help from science whatsoever, has decided that permissive parenting is the only acceptable parenting model. In spite of years and years of studies looking at this, and the conclusion has been, this is a lousy form of child rearing. You end up with very low self-esteem, very low social proficiency, very low academic proficiency, very low occupational proficiency. The outcomes are horrible. They're horrible. The only thing worse is absent parenting. Okay? But I'll just give my kid love, and no consistent discipline is a recipe for disaster. You just wasted your kid's life, and the likelihood of them ending up very much in trouble and not achieving their potential is extremely high. So that is a factor. There needs to be, children require a much firmer hands-on approach, both with affection and discipline. In order for them to achieve their potential, they need that, especially in those early years. Now, the other thing which I talked about last time was the cannabis situation, where you have, in some situations, 30% of mothers who are using cannabis during pregnancy, which this is so unjust. I mean, all the other problems I have with cannabis, fine, but this one in particular is unjust is to border on criminal. You're literally lowering the IQ of your child for life, and the child had absolutely no say in this. Okay, this is an atrocity. Yeah, when you think about what about future generations, 30% is a lot of people. 30% is a lot of people that are exposed to this. So, I mean, you've got these things, and then you just have the way our society thinks of relationships as throwaway, as it's for temporary recreation. It's like when you understand what you're doing, when you treat intimacy as throwaway recreation, what you're condoning is lying. Because what's happening when you're pair bonding like that, and interacting with people briefly and then tossing them aside, is you're communicating, you're partially bonding with them. And so we partially are saying, you're the one, you're special, I really care enough about you to invest in you. That's what the act is biologically saying you. And then it's like, just kidding. you know, it's like raising a kid for a couple of years and saying, you're not the kid I actually want, I just use you for practice for the kid I really do want. So I'm going to say bye now, find yourself another parent, and I'm going to move on to somebody else. And it's like, this is what's happening. Even if the participants don't realize it, emotionally, this is damaging to people's psyche. Okay, it really is damaging. Okay, and over time, it contributes to a deep sense of loneliness. So we have a lot of problems in this culture. I mean, if we just go from the diet, from our behaviors, and again, we talked about the digital media, what it's doing in terms of social maturity. I mean, this is really a huge experiment, and the experiment is failing. It's failing miserably in terms of quality of life, lifespan, suicide. Every measure of health is going down. And we just have multiple things at once. And so the need for psychiatric care has never been higher, but the demands on us are also very high, because now we've got to provide all this psychoeducation that people used to know, and now it's been lost. And now we got to go back and we've got to teach them how to be friends, okay, and right from wrong. I mean, that's kind of what it comes down to, yeah.
I was just wondering about your opinion on like this revolving door dating style.
Yeah.
Like, Tinder, and I'm having a really hard time communicating like that is probably not a good idea to clients, but they'll usually try it out and then they'll find that out for themselves.
Yeah.
And then we talked about like volunteering or some other community activity so they can get to know themselves and then have a better.
Yes. Yes, anything is better than what you're doing. Revolving door dating, you just set yourself up for so many. I mean, just think about all the things that you set yourself up for. You are swimming in shark-infested waters. Okay, you got shark, you got your barracuda, you got your piranha. Okay, you're looking for a dolphin, but you're in shark-infested waters. All right, the likelihood of finding a dolphin, So the horror stories over the years. The horror stories from that. I mean, it's like, come on, it's like. It seems like a good idea at the time. People go through a divorce and right away they need to get out there and date, and they don't know where to start, and they go right to those places, and that's how you end up with STD like 2 weeks later. Okay, because what happens is in this culture, people expect you to be physically intimate on the third date, which I think is whoever made that up had horns and like fire all over them, because that's like, what is wrong with you? What is wrong with you people? I mean, I could think of a trillion reasons why that is a horrible idea. Okay, and yet it's so expected that something's wrong with you if you don't participate, and you're made to feel stupid. All right, this is the craziness of this culture. All right, if you want to date more responsibly, get in a time machine and go back because right now is not a good time. Okay, yeah.
I just want to say, it's like a mother with young kids listening to this. It's so confusing.
Yeah, I know.
I mean, I'm like, make sure they eat every color vegetable possible. Make sure that they never have the technology. Make sure that, you know what I mean, that they're eating enough so their bowels work properly. I mean, it's so stressful. Don't let them go to friends' houses because something terrible is gonna happen.
Yeah.
And they don't know how to make friends, and they're in daycare, or they're
Right.
going to be here.
Yeah, right.
So like, make sure it's the best daycare ever, and they're being loved
Yeah.
with kids, but don't kiss them too much. It's like, it's so stressful, right?
Yeah.
And that's terrifying. Like, how? So this is my question.
Yeah.
How can we, like, instead of, there's a lot of my parenting, the
Yeah.
guy is out of fear.
Yeah, right.
That we have so much fear of ruining them and just, everything we do is wrong. And there's so much pressure as moms because we now have to work. Like, it's not what it once was.
No,
right,
no.
For us either. And you don't want to be parents at all.
Right.
You want to just can't spank them. It's just like, what are we supposed to do? What are we supposed to do? That question, please.
Yeah. I got 3 minutes. I no problem.
It's
Me.
really, it really is. Like, when I first gave my youngest baby peanut butter, I
Yeah.
sat there like this. Is she gonna stop breathing? I was not, and I don't have allergy, but it's
Yeah.
terrifying. Being a mother is terrifying.
Yeah.
Terrible.
Well, one thing is important.
It's so wonderful, but it's
Yeah.
still like,
Yeah.
there's so much pressure.
Yeah.
There's
Yeah.
so much pressure.
Fortunately, children are quite resilient. And the thing is that parents have been winging it for thousands of years, and it turned out okay. It's just that our culture has gone so far off the reservation. I think it's not you. I mean, parents of all ages have had the same issues, and yet, even with all the mistakes, the kids turned out fine. All right. But the thing is that our culture has taken such a huge turn in the last 50 years. I mean, it's if you take a look at lifestyle offerings, I mean, they've just exploded, and the acceptable habits have just gone the wrong way. Now, with regard to diet, you don't have to do it perfectly. Fortunately, there are polyphenols all over the place. Even if they don't eat a lot of vegetables, you can even get them in supplements and everything. If you drink chokeberry juice once a day, you're kind of covered a lot of times. Or eating blueberries. I mean, the thing is that it's there. Because what's happening is that these things are like absent. If you trust a kid to eat fruits and vegetables, they're not. They're not. And so these are things that need to be encouraged. Not every meal. And it doesn't mean that you can't have fast food every now and then, but you want to be mindful of bringing in that balance. Okay, that's really, really important. With regard to digital devices, you limit it. You can't say no to all things, but you have to encourage them. No. And if you have more than one kid, that's good, because you want face-to-face play as much as possible. You want them to play together. You want to use your imagination. Okay, go out there and without, I'm going to tell you, I am very concerned about this digital thing. I have some grand nieces, and every time I see those kids, I mean, up on my farm, they're out there, they've got all these acres to run around and play in. I go outside, they're outside, yay, in the sunlight, good for them. They're sitting on a stump, both of them, with their digital devices watching cartoons. I'm thinking, this is like, I was just sad. I was like, this is just sad. Every time I see those kids, that's all they do. And I'm thinking, they are going to be so messed up. And I'm just a great uncle, so I mean, what do I know? But I'm thinking, this is a disaster. This is truly, it's terrifying. It's terrifying. There is no way these kids are going to grow up well balanced. I guarantee you. Well, beautiful little girls, I'm sorry. I feel sorry for somebody who marries them or whatever, because they're in for a lot of trouble. They're in for a lot of trouble because they are not socialized. They are absolutely, they have the social maturity of a 2-year-old, and they're going to have that their whole lives if this doesn't end. And the thing is, you ever try to take a device away? Once they get used to doing this, do you know how hard it is? It's like taking away their heroin. I've seen it in my office. I have seen it in my office. They take away that device, and the meltdown, and what do the parents do? Boom. Right back. Yeah.
I kind of have an opposite question on this continuum. So I see a particular client that was raised without devices, kind of all of the right things.
Mm-hmm.
She's struggling socially.
Yeah.
Her social skills are not developed in the culture that we live in.
Yeah.
So speaking back to that balance, she's not allowed to do any of the things that you said that are detrimental, but yet she's still experiencing high levels of anxiety.
Well, the thing is that there are certain conditions that do that biologically. If you look, for example, at Asperger's, for example, it does happen in girls. Okay, so we do see that. In fact, one of the papers that I didn't talk about there was looking at oxytocin receptors in people with Asperger's. Okay, so there are individuals who have that. And so their natural social skills are impaired from the beginning. And that's where there is now cognitive behavioral therapy for people where you can use, because what happens is the area of the brain that's under functioning is the medial prefrontal cortex. And so what the goal of therapy is to get the other parts of your prefrontal cortex to make up so that you don't automatically, you're not able to read people. My stepson had Asperger's. I mean, it was really bad when he was younger, and it was horrible. He's better now, but let me tell you, growing up, we had all kinds of problems with school and conflicts because children would say things and not keep their promise, and he'd have a meltdown like, you're supposed to do what you say. You know, he wasn't able to read nonverbals, and it caused a lot of problems. So people with Asperger's spectrum stuff, they're the ones that are going to have a really, really difficult time. In addition, some people are programmed to be more careful individuals. If you take a look at personality and character spectrums, some people are over here where they like things predictable, they don't take risk, and when things go bad, they remember them for a very long time. These are cautious people. Over here at the other end of the bell curve, you have people who are very cavalier. They get wounded over and over. They don't care. They're going to go for it again, you know? All right? And then you have people in the middle. Okay? Well, people over here, when things go awry, they have a hard time letting go of that. And it can affect them socially, okay? Because things are supposed to be a certain way. So they're not quite Asperger's, but their caudate nucleus is very active. When something is not right, they can't let go of that. They have a hard time. You know, and so we have some populations that even though everything is right, they still have issues, and that's where they have to be taught how to read and about socialization and everything. Okay, yeah.
Along the lines, it ties in with my last curveball here. In trying to help clients pursue love and belonging, purposefulness, respect, I mean, all great things. I continuously get young kids, adolescents, adults who figured out how to pay their bills under these circumstances with what's called the impossible task.
Mm-hmm.
We've gotten to a point where literally outside of maybe doing school, maybe, or going to work, maybe, everything else you suggest, no matter how loving you do it, no matter how much tough love you use, no matter how many hats I put on, it's like there's always this impossible task. Every week it's the same thing. So did we try this baby step? Well, no. And here's my list of reasons. Did you try this baby step? Did you try this? Did you try this? I struggle with the clients that had what seems to be the impossible task. So I guess I'm giving you the question of if you have any kind of suggestions to do with those types of clients.
That's why I brought that up. For the clients that refuse to participate in your suggestions, there's not a lot you can do. I mean, you can lead a horse to water, you can't make them drink. And this is just like physical therapy. You know, I had a sports injury where I ripped my arm out of my socket here, and it required surgery and extensive repair. They had to go in and rebuild the shoulder and all that. That was very painful, but at one point I was unable to move my arm above here. After the surgery and with the painful therapy, you know, I got my full range of motion back. But doggone, that hurt for like 2 years. I mean, it's still a little sore, all right? I mean, but without that therapy, I would have lost my right arm. I had to do the therapy. Had I not participated, the outcome would have been dismal, and no amount of medicine, no amount of counseling couldn't fix that. And that's the same thing here. If you have people who just have excuse after excuse you can sit there and explain what to do, but it's like telling somebody to eat healthy. If they don't do it, guess what? Nothing will change. You know, and so we do the best we can. I mean, that's kind of what we want to do, is we want to make good brain nutrition available to them as far as we're concerned. But again, if they don't participate, there's nothing we can do. I mean, you know, our goal is fulfillment. We want them to get as much love, enough purpose, enough respect, enough freedom, as much as we can. And this varies from person to person. Okay? What's enough for one might not be enough for another. We want that person to get enough so that their mood is cool. All right? So that they're not suffering anxiety and depression and hopelessness and crying spells and suicidality and all that kind of stuff. All right? But they have to participate. And so one of the things I try to stress with the psychoeducation is, if you don't participate, you're not going to get better. Yeah, and so when you're coming at me saying, that medicine's not working, I go, did you take the supplements? No. Are you doing what they're telling you in therapy? No. We're not getting anything out of it. Well, are you participating? And see, that's the other thing. They say, I'm not getting anything out of it. Well, what do they expect? Do you give them a gold star? You know, what are you supposed to give them, you know? I mean, they have to participate. They have to participate, yeah.
Well, things that you'll gain from a change is a lot more powerful than like thinking of what you don't want. So I always just like normalize like the fear of change and how, you know, we're humans, so we'll make mistakes in our attempts to change. But here's what you can look forward to if you choose that. So I find that that's usually
Yeah, no, that is, it's important as part of, motivational strategies is, what do you have? And that's kind of one of the reasons why it's nice to have an actual concrete list of, because this is, I mean, do you want enough love? Do you want, and I've never had a person say, you know what, I don't want that stuff. I've been doing this 22 years, and not once, not one time has a patient said, hey, I don't agree with that list. You know, I don't think I need that. I've not had one patient out of like 200,000 patients, okay? I used to work in a hospital setting, so I would see like 20 people a day, every day, different people, okay? So I've seen like 200,000 people. I have never had anybody say, I don't want that, okay? And that's kind of, you know, that's why I started at the beginning. Where are the holes? Help me identify them. Where are they? Patients will usually tell you where they are. Okay, why are we doing this? This is why we're doing it. I want you to experience fulfillment. Is that something you want? Usually they're going to say yes. They're going to say yes. So I think that is, yes. You don't just want to say, or else bad things will happen to you. This is the goal. And if you get this, what do you get as a freebie? You get that happiness you're looking for. Okay? Not happy all the time, but that settled fulfillment, a sense of true contentment with what you have and where you are and who you're with. Okay? Yeah.
Thought just occurred to me in light of some of my patients that are kids, they're able to, let's say, go through a list like that and search for, you know, their quality of life, but they live in a family environment where the parents are less able to do that than the kids are, and it's like, you know, battling a stream in therapy.
That's why I didn't do child psychiatry.
I
I found myself getting very angry at those parents. I see they were giving me mental problems because I would be so angry. Because I worked at Hawthorne, and I tell you, some of those parents, because you get attached to these kids, and then you send them back into this outrageously abusive situation. And all the work that you've done, just gone because the parents are the problem. Just about every kid that I saw, in fact, 100% of them were there because of outrageous abuse. And so the parents aren't your patients. Okay, I remember one parent said, okay, you can talk to my kid about it, but don't you dare ask him anything about the home life. That's off limits. You know? Cool. Wow. It's like, yeah, that's not suspicious.
Sounds fine to me.
And it's not to turn to you and blame you as a parent.
Yeah, I'm ruining my kids' things.
Yeah.
I do have a question about the excessive manipulation or the
Yeah.
freedom from excessive
Yeah.
manipulation. Can you just elaborate on
Oh,
that?
sure. Oh, easily. Yes, absolutely. Now, if you take a look at people in in settings where the adult population is very much in substance abuse or very, very poorly educated, a lot of times you'll find a lot of manipulation as a lifestyle. Humans manipulate. When you manipulate, what that means is that you are treating others in a way you wouldn't want to be treated for the purpose of making sure they do what you want, making sure they believe like you want, making sure that they don't do what you don't want, and making sure that they do what you want. And so you manipulate by lying. Prevarication, deception is the #1 tool for manipulation. So deception, verbal abuse, physical abuse, threatening to take away resources, threatening verbal or physical harm, taking away resources, shame, comparing them to other people. These are all manipulation techniques to make sure that others fly the way you want them to. Now, if everybody in your inner circle is manipulative, your sense of autonomy is dead, man. You have no sense of autonomy. And therefore, you're not being treated as an adult. Now, as a child, you shouldn't have a lot of autonomy, but as you get older, you're given more. Your parents, good parents, give you more autonomy as you age. That's what's supposed to happen, is more and more autonomy the older you get. Okay? And as an adult, you can't get rid of all manipulative people in your life, but you want some people in your life, in your inner circle, that will treat you like an adult. All right, and they let you make mistakes. That's what love does. Love allows people to make mistakes. Okay, but if everybody is manipulative, you have no autonomy. You have, bottom line is that you're being treated like a child. We don't like jobs that have low autonomy. That's why I left radiology. Is because for 10 years I had to be an employee, and it means people looking over your shoulder telling you how fast to work and how to do your job, and I don't like that. Okay, because their idea of what I should do and my idea of what very often differed. I like, for example, when I did procedures on people, I like to wait until the anesthesia took place before I started working on them. And seriously, this is the fight we had. I was waiting too long for the anesthesia to kick in before I did my procedure. All right, and this was ridiculous. I don't like when people scream when I don't work on them. Okay, and that's what was happening. And they told me that we get paid the same. Once you inject the anesthesia, we get paid the same whether we wait or not. And the more people we see, the more money we make. Okay? And that was one of the last straws before I left. Okay? So autonomy is very important. If you have people looking over your shoulder, telling you what to do, trying to abuse you if you don't do what they want, that's a lack of autonomy. You need some freedom. We like jobs where people say, this is the job, use your professional judgment to carry it out in the way that you want. That's a job, we'll take less money if we have autonomy. Okay? We like our freedom. And the more adult you are, the more you want that. And one of the jobs that my patient has is, look, you need to identify the manipulative people in your inner circle and kick them out. Okay, don't put them in your inner circle. You can still know them, you can pray for them, you can help them, but don't tell them all your secrets. Don't bring them in onto your heart's most deepest desires. Don't loan money to them or trust them. You can loan if you want to, just don't expect it back. Okay, but don't put them in a situation where they can harm you. Okay, put people you trust in your inner circle. Okay, inner circle hygiene. And if you want freedom, you have to practice inner circle hygiene. Does that answer your question?
Very
Okay. Yeah.
I just in light of the autonomy and developing your own sense of who you are.
Mm-hmm.
A lot of times what I give kids as a task is to cook a meal with their parent. They can choose which parent. To do that once a month.
Oh.
And I invite 4 and 5-year-olds.
Really?
Because they can make cookies by digging, forming the dough.
Right.
But it allows them to fail, and yet, so what if I burn the chocolate chip cookie? I'll eat it.
Yeah, very good. Yes, yeah. That's a very, so many people, and the problem is that most parents don't know how to cook now. Parents like, what are you doing? Yeah. So cooking is like going to McDonald's and pushing the kiosk button,
Yeah. But it's a great bonding exercise.
It is, And the thing is that, if you look at third world countries, and I think I've mentioned this before, it's really embarrassing. If you look at a place like Papua New Guinea, where they live like cavemen. They have no amenities, no health care, nothing. They're dirt poor, they're a hunter-gatherer society, and yet their depression rate is 1 in 3,000. In the United States, the culture with the least amount of depression are the Amish. And you think that there's a lot of, the thing is that they know how to do things though. You take a look at your average Amish 8-year-old, they can like build you shoes, kitchen appliances, they know how to do stuff, and so their brains are involved in activating that central executive network. They feel competent. I mean, they and that does. With our kids, they don't know anything until they graduate from college, right? And even then, it's liberal arts, I mean, that proficiency is really helpful, So anyway. All right, I think we're all set here. Thank you very much.
Thank you, Dr. Guy, for answering so many of the questions.